Mike Mincy, what's going on, brother? How you doing? Della Holloway, how are you? Isara Race, I hope I said that right. I haven't seen you on before. How are you? Tawana Bronson. Sheila's Closet, how are you? Legacies Enterprise, LLC. Ella Flagger, Jackie Yard, Turhan White, what's happening? Duro Vaughn. Ryan Bembry, how are you this evening? Safania Cersei, good evening to you. Phil Battle, Noah Strong all day. Tanya Tucker, Gwen Smith Stokes. Odessa Williams, April Anderson Brown. Tanya Tucker, Elizabeth Ramos, Larry Seeley. Tanya Bowers, how are you? Andres Winter, Ruth Ellis, Lala McLean, James Williams, Joanne Brevard. We have a good segment for you this evening. Sharonda Gordon, Haviland Kitchen, how are you? Gloria Anderson, God bless you. Maurice Faulkner. Just want to thank you. Felicia Macklin, Pamela McCleaven, Robert Hill, and Jeanette Ellis Harper, Nadira Muhammad, afternoon to you. Carlos Lane, Cheryl Coxon, Julia Barron, Celeste Edwards, happy Friday. Blessings and glory. Dorothy Stratford in the building, Gina Reynolds, Muhammad, Maisha Williams, Ralease, happy Friday. Betty Jenkins, Stacy Perry, Andre Scott, Joyce Tidwell. How are you, Miss Tidwell? Ida Williams, Michelle McCall, how are you? Ophelia Ledette, Fatim Muhammad. Buenos tardes, Mr. Rodriguez Ramon, how are you, sir? Diane Murray, Renee Daniels, Chris Evans, blessings and glory. Shouting us out all the way from Texas on vacation. Thank you, brother. Hope you all well and safe out there in Texas. Get back safely. Elaine Hopkins, Willie Christmas Smith, Donna Messier Moore, Jahi, Mathis, Lady. Let me get to the show. How are you, Reverend Scott Roundtree? God bless you. Richie Will Love, Sajada, Annette Martinez. Some of these new folks, Verdell Moses Boyd, God bless you, sir. Dina Corbin. G. Kiernan. Let me get right to it. So we have a great session for you this evening on Facebook Live. We have our acting director of health and community wellness, Ketlin Osbrook is here with us today. And Dr. H. Kelly is with us as well. Dr. Kelly, how are you? Glad to have you both on this evening, and welcome to you, Dr. Kelly.
Thank you.
I guess we have several things to talk about, but I'll give you a chance to introduce yourselves really quickly so we can get right into it. You can go first, Director.
Sure. Good evening, everyone. My name is Ketlin Osbrook. I am the acting director for the Department of Health and Community Wellness. I've been employed here at the Health Department for over 20 years, most recently as Chief of Staff, and it's a pleasure to be here.
Yep. Doctor?
Good afternoon, everyone. I would like to start by saying thank you to the city of Newark. Thank you to Mayor Baraka, and thank you to Caitlin and the rest of the Newark community for thinking of me when it came to this position. I am a resident of Newark. I was born in Cuba and raised here in the United States. I went to Barringer High School. I'm a graduate of Barringer High School. I went to Rutgers University, and then I went to medical school in New York. And I came back first as a teacher, for many of the elementary schools here in Newark. Then to Rutgers University, where I taught biology and pre-med. I also work there as a physician. I currently work as one of the only bilingual consultants for the state when it comes to disability and benefits and for the Board of Education. And I'm looking forward to reuniting again with my friends at the health department, as I was the previous medical director of the health department as well. So thank you, Mayor, and thank you.
Yeah, we want to make that happen. So good stuff. Just want to talk a little bit about on the last couple of lives, people have been hitting me with a little bit of the monkeypox thing. You know, people are a little nervous about that. I know, you know, they've been talking about vaccines lately. So anything, you know, that can help us get ourselves together around that would be great. Get these people to know what it is and what to expect.
Yes, Mayor. So monkeypox is a virus that has been with us for a while now. It first made its introduction back in 2003 as smallpox, and now back in 2022 and previous 2003 as monkeypox. So the thing that we really need to know is, what is monkeypox? So monkeypox is in the family of the orthopox virus, and it's related to smallpox. The characteristics of monkeypox, which is what is going to allow everyone to know, hey, maybe I have monkeypox, is the rashes and the vesicles that we get on our skin. And that along with some flu symptoms, but the flu symptoms may be exhibited or they may not. The main thing to look forward is to those vesicles that appear in our skin. They have an umbiculated cover on them. They're hard and painful. How do we know if we've been exposed? How is this virus spreading? This virus is by direct contact with a person that has been exposed or that carries a live virus, which means that if we know how we are exposed, we know how we can avoid it. We can avoid this virus by restricting direct contact, especially if we know that someone has been infected. By making sure that we maintain our distance. So I know that we're all looking forward to, you know, COVID being over, but we still need to maintain those distances. We need to wear our face covers, as we know our masks, as droplets have been known to also transmit the monkeypox virus. This should not become a situation where we're afraid to interact with other people, as for immunocompetent individuals, those that are not immunocompromised, the likelihood of infection is very minimal, and it's something that so far has been self-contained. There are vaccines for the monkeypox virus, and the vaccines are now being limited to people that have a pre-existing medical condition, or they are high risk, and for people that have been exposed. What constitutes high risk? High risk is any individual that, for example, has skin conditions, eczema, or anything that predestines them to have their skin open for whatever reason. And high risk can also be someone that is at home that has bed wounds, and then someone that's taking care of them it's exposed, or normally they might go and take care of this person without knowing that they're transmitting the disease. Because of that, we need to be careful with bed covering, making sure that if someone at our house is exposed, that we are cleaning our furniture and that we are washing our clothing. There are 2 vaccines now that are ready that are being used. Really, there's one that is being used more than the other. One of the vaccine is the Unesco Vaccine, and it's indicated, approved by the FDA for individuals greater than 18. And it's being given for high-risk populations, as I explained before, and for people that have been exposed within 14 days. The risk of containing the disease is very high. And for people that have been exposed after the 4th day, the risk minimizes the symptoms.
And to add to what Dr. Kelly said, currently there are two primary pathways to getting access to the vaccine. So if you are direct contact, what will likely happen is our health department here in the city of Newark will be notified of any positive or presumptive positive cases, at which point that'll trigger off the contact tracing process. And through the disease investigation, we'll identify any direct contacts and we'll coordinate with the Hudson Regional Health Commission, which is serving as the vaccine hub for Hudson, Union, and Essex County, to get the vaccines here to our health center and to bring the direct contact here to be vaccinated. The other pathway is for those, as Dr. Kelly mentioned, who are high risk and believe they've been exposed but can't necessarily confirm it. They can actually go to NJCRI, one of the three community-based organizations that have been established through the state to provide vaccines to those individuals. I know the state is in preparations to add at least 2 additional sites, one in Bergen and one in Camden County as well. So those are the 2 pathways right now. And again, the vaccines are limited right now as part of phase 1 to people who are actually direct contacts or those who are high risk and believe they've been exposed.
That's great information. I'm sure that people will benefit from that. Hopefully people were taking the notes and paying attention to that. It's very helpful information. Something that's been bothering us for the last week or so is this code red. I tell people what code red is, and the temperatures have been very hot. You know, in Newark, it gets hotter than most cities in America because of the impervious surfaces. We have a lot of concrete surfaces and not enough trees and green space and all of that. And we're working on that, tree planting, painting white. So look to that in the community, folks. Look to that, help us out. We're going to be doing a lot of things around tree planting, around trying to decrease the degree level in our city so it's not as hot. So Kelly, you want to talk about the code red for a minute?
Sure. So there's 3 objectives to a code red alert. Obviously, the first one is to prevent exposure to extreme heat conditions and to minimize the number of people who are going to experience adverse health effects as a result of it. Secondly, it's to coordinate all the resources within the city, whether that be through the departments, the municipal departments, through our partnering agencies, and through community-based organizations and volunteer organizations as well. And thirdly, it's to educate the community on ways to minimize their risk of developing a heat-related condition. And so what typically happens is if there's a heat wave projected, which i.e., temperatures of 90 degrees or greater over 2 consecutive days or more, and a heat index of 100 or greater, then we'll issue out a heat warning, which lets the community know to be prepared. It activates the rec centers, the pools, the senior centers, the shelters. We have community-based organizations who will go out in the community and engage our neighbors without addresses to try and encourage them to get out of the heat. And then you have, of course, your extreme heat situations like what we experienced last week, which would result in a heat advisory. And that's when you have a heat index of 105 or greater for 2 or more days. And in particular, when we're talking about the heat advisory, we really look at heat index because heat temperatures tell you one thing, but heat index really gives you a better sense of the human experience, what we feel like when we walk outside. And so it takes into account the relative humidity in the air. The greater the relative humidity, the greater the heat index will be. And so we look at those 2 factors and we issue out those code reds so that we can activate all the resources in the city in order to protect our residents.
Who can actually go into a code red location though? And where are they?
So we have, of course, our rec centers. So we have at least 1 rec center in each ward in the city. We also have the pools that are open in the summertime until about 7:30 p.m. I believe there are about 7 pools across the city. And we also encourage people to take advantage of free opportunities to get out of the heat. So visit your libraries, visit your malls. If you have a little money in your pocket, you might want to go see a movie. But you really want to seek out any area or building that has air conditioning if you're not lucky enough to have air conditioning in your own home. We also encourage you to drink a lot of water. If you need to engage in any strenuous activity, try and be strategic about it, early in the mornings before 10 a.m. or later in the evenings after 8 p.m. after the sun has set. Those are some of the ways that you can protect yourself from experiencing those heat conditions.
That's great. And if you're elderly and a child, you know, you need that, right, for more than anybody.
Absolutely. And you always want to look out for our vulnerable residents, seniors, infants and children who may not be able to protect themselves from the heat. People with underlying health conditions are also susceptible. Pregnant women, women who are breastfeeding are susceptible to dehydration as well. So look out for our vulnerable people, encourage them to seek cooler temperatures where they can. If you can't get out of your home, you can do things like avoid cooking. So you're not increasing the heat in your home. Keep the shades closed so you're reducing the amount of sunlight that's coming into your home. Get a wet t-shirt or a wet rag and put it over you while you're sitting in front of a fan. So there are ways to definitely minimize the risk, even if you can't get access to air conditioning immediately. But if you think you're experiencing a heat-related condition, I'm sure Dr. Kelly would agree that you need to seek medical attention immediately.
I agree with everything that's been said. In addition, I would like to further put out the need for us to keep our mental health patients on the alert and keeping an eye on them. Mental health is one of those conditions where they might not react, or they might be aware of what heat exhaustion or heat stroke is, or even the fact that the temperature is so high that now I need to seek help. Construction workers, people that are, for example, alcohol users. These are people that, due to an addiction, may not have the necessary skills to go and seek help. So as a community, it would be good, a good thing to go and keep an eye on these individuals.
Yeah. So remember, all of the rec centers are places to go, and the public buildings, you could go in there as well to, like, to the libraries, different places like that, cool off. Please, water, all of those things are available for folks. And I know we're going to have more heat waves coming up this summer as we get these, you know, these events, as, you know, global warming continues. We're going to get these kind of strange weather events that happen, the kind of flooding, the heat, and all the other things that are taking place. We need to just be cautious and aware and help each other out, have a mindset to help each other out. You know, you have neighbors, people in your building, on your block, who may need some extra attention. You might need to ring their bell, check on them, look, make sure they're okay. The seniors in there, they might not have air conditioning. And if you have a building and your building, it still has on the heat. And we ran into that situation at the reservoir up on South Orange Avenue. We had to send code enforcement. Please call code enforcement, get us out there. You know, the heat should have been off in your building. So let's make sure that is also taking place. I want to talk a little bit about, before we get out of here as well, about some of the things that we are proposing, some of the mobile units, and what we learned, how to, you know, how we should probably be delivering healthcare because of COVID. I think it taught us, you know, or made more salient how healthcare needs to be, you know, kind of altered a little bit in terms of delivery of services. So what is our plan going forward?
So right now we have 3 medical mobile units that are being configured. We're hoping for them to arrive here in the city by first quarter in 2023. And the intent is to bring healthcare services into the community, into areas that are vulnerable, areas that are underserved, that haven't been very well penetrated. So we're going to deploy the medical mobile units, but also look at the data to determine if the deployment needs to be relocated to another area. In addition to that, we have a dental mobile unit that is currently being configured as well, and we want to bring dental services out to the community as well. Through a wonderful opportunity and partnership that we have with Seton Hall University, we're hoping to bring advanced practice nurses into the medical mobile units. They will provide services to our residents, and it's also an opportunity to teach nurses and incoming APNs how to provide services in a community way, in a sympathetic way and empathetic way. So it's a great opportunity that we're looking forward to rolling out. In the meantime, we're looking at also opening up locations within some of the schools here in the city. So we've identified schools where we can go in and establish a health center. And also one of the schools in particular is in close proximity to a large public housing facility in the West Ward of Newark. And so we're hoping to be able to not only provide those health services to the families and the students that attend that school, but also to the residents of public housing in that area. So we have a lot of ideas and a lot of strategies that we're putting in place, Mayor, to bring health services into the community. We're excited about it.
That's good. You wanted to say something, Doctor?
No, it's things that it's what every doctor's dream is. It's made out of, just to serve and to take care of my community. So,
how do you think any one of y'all COVID has changed our way of thinking about the delivery of healthcare services, if at all?
I think it has. I think that the need for more equality in the delivery of healthcare services has surfaced, and it's something that we were struggling as far as making it more evident to the larger community. The need for equality, the need for better management of chronic disease conditions, the need for just self-responsibility, because we do bear some responsibility in our own medical care. So all these things, the need for more community, for a sense of, that you're my brother, you're my sister. Let's work together and be better. So yes, I do think that many positive things have surfaced, and at the same time, many negative things.
Yeah.
And it also reinforces the idea that we really need to build this culture of health here in the city. We can't continue to be reactive. We have to be proactive, right? Because a lot of the underlying health conditions that our residents face exacerbated the issue of COVID in our community, particularly in the first couple of waves. And so preventive care, and which is why the medical mobile units are going to be hopefully a strategic and effective way of reducing some of the chronic health conditions, or minimizing some of the health conditions that our residents face. So we have to be proactive. We can't just continue to be reactive.
That's good stuff. I want to remind people, August 20th, we're having a citywide march, action against violence in the city, gun violence and all violence in specific. Be on the lookout for that. I'm walking the 13 miles across the city. If anybody want to join me in that walk, please, you can ride your bike, motorcycle, moped, car, or walk with me. Come do it. We're going to stop at every ward. Be on the lookout for that. I need everybody to participate. Any last things you ladies want to say to the audience before we bid them farewell? Have a great weekend.
Always forward, never back.
That's right. That's right. That's right.
Yes, indeed, Dr. Kelly. Newark strong always.
Yeah. All right, everybody. Thank you, ladies, for getting on. God bless y'all. You have an incredible weekend.
All right. Thank you. You as well.